is urine protein and there is what's called an inactive sediment, meaning there's no evidence of an infection, then we want to run a test called a urine protein creatinine ratio. And that confirms that there is proteinuria or loss of protein in the urine. And then it also quantifies it. So it gives us a number to help us determine how severe that urine protein loss is. Last, we look at the sediment, and to obtain the sediment, you take 1 to 3 mils of urine and you put it in a tube and you spin it in the centrifuge. And it's usually on a lower setting than you would do for blood. And then once it's spun down, you either have a small or large pellet or nothing at the bottom. And that pellet is all the cells and goop and potentially infection or crystals that have settled out. And if you see a visible pellet, then you basically dump off all of the urine except for the pellet. And if there's no pellet, then you dump off all but like 1 to 2 drops. And then the remaining urine-y, sedimenty stuff that you have in the bottom, you can like flick the tube, or I bang it on I like knock on the counter. And then I take a pipette and I suck it out and I put a drop on a slide and you put a cover slip on and then you look at it under the microscope. And everything is done under 40x. You could do like a survey under 10x, which is the second to lowest, usually the second to lowest magnification. Some people use stain. I really hate SETI stain. That's the name of the most common urine stain, just because what happens is it always gets contaminated and it makes like these weird crystals and it's just distracting. So I would prefer just to look at the urine. And the best way for you to look at it under the microscope is you want to make your aperture small, and you want to have it more like backlit, and that helps you see things a lot better. So bacteria, there should be none. Sometimes you can see contamination, and you'll either see rods or cocci. So rods look like rods and cocci look like little balls. And we have a semi-quantitative scale. Usually it's like 1+, 2+. But ideally, you try and count. So if you see like 10 bacteria per field, then we'll write that. But if there is too many bacteria, then we call it TNTC, which is too numerous to count. Casts occur when protein precipitates in the renal tubules. So there's like 2 main portions of the kidney. There's the glomeruli, which is like the ball, and then the tubulars, which are the tube. And if protein kind of sits and settles in the renal tubules, those tubes, and then they pee it out, you'll see it in the urine. And it usually indicates some degree of backflow or urine stasis, and it can indicate kidney damage. And there are a couple of different casts that we can see. There's what are called hyaline casts, and those are pure protein, and they're really pale cylinders. There's granular casts, and those have some cellular debris, and they can indicate kidney damage. There's cellular casts, and those contain cells, and they can suggest like severe kidney damage. There's fatty, and they contain fat droplets, and again, severe kidney disease. And then waxy casts can also indicate kidney disease. So really, casts are not a good thing to see. Hyaline casts you can occasionally see, and it's not necessarily a big deal. It just depends on if there's a lot of protein in the urine and what the urine concentration is. Crystals, there really should be none. Occasionally, you can have like a random one, and that's not considered abnormal, but it's going to depend on the pH. So triple phosphate or struvite crystals are going to be common in alkaline pH, and calcium oxalate crystals are going to be common in acidic pH. And usually crystals indicate that there's an issue if they are recurrent, but if the urine sits out for a really long period of time, it's going to start to form crystals. And so if you have crystals and you're concerned that there may be an issue, then you can repeat a urine sample and get like a fresh one. There are other types of crystals, but when you talk about bladder stones, the 2 that you can see on x-ray are struvite and calcium oxalate, and those are also the most common. And struvite are the ones that you can sometimes dissolve with changing the diet, and calcium oxalate never dissolve, and they have to have surgery to remove them. Red blood cells, 0 to 2 per high-powered field can be normal, and large numbers can be due to trauma in the bladder, trauma in the kidney, weird infections in the kidney or in the bladder. And white blood cells, again, 0 to 5 or 0 to 2, depending on the lab, is normal. And they increase with infection. If you have a sterile cystitis or sterile bladder inflammation, you can sometimes see elevations in the white blood cells without changes in, like without the presence of bacteria, but it's pretty uncommon. Then you can see what are called renal epithelial cells. So basically cells that are in the kidneys, and large numbers of them also can indicate kidney damage. You can see squamous epithelial cells or transitional cells, and those are bladder cells that sometimes you'll find, like, because everything sloughs, as things are replenished, some of the cells kind of slough off and they PM out. And small amounts are not a big deal. 4 to 8 is not super exciting. But if there's tons, and especially if there's abnormal looking transitional cells, that can be indicative of a potential cancer or tumor in the bladder. And then other random things we might see: sperm, if they're an intact male dog, and sometimes fat droplets. So all of that information together helps us kind of determine the bladder and the kidney health, and it just helps add that little piece, that little key to the puzzle. So I hope that these last 3 little talks are at least somewhat helpful, not too boring, but give you a little bit of information as to why we put so much stock into our wellness blood work and all of the information that we can gain, even if it's normal. Because even if it's normal, like, that's still a ton of information about your organ systems that we have obtained and that we can then use to help ensure that your pet stays happy and healthy. I think that about wraps it up. As always, thank you for listening to this installment of Vetsplaining. I hope you enjoyed your time with me and ideally learned at least one new thing for the day. If you have any questions or suggestions for future topics, feel free to leave a comment below or email info@independenthillvet.com and put podcast topic or podcast comment in the subject line. Until next time.